Hello, this is Dr. Taylor, and I wanted to just go over a quick case study from an interesting case that I had in the office just a few days ago. This is a 21-year-old patient with fatigue, anxiety, insomnia, and mood swings. She did not have the energy to apply to school or to maintain relationships because she had been away to school and been in a relationship with a boy, and the relationship broke up, and it really devastated her, and she had to move back home. And since she's been home with her mother, she has really not acted like a normal 21-year-old. With the fatigue, she hadn't been able to even get up enough energy to even apply. It was too anxiety provoking. And she reported her symptoms to be moderate to severe. And her mother was crying in the office because she was so concerned about her daughter, maybe never being normal again. And she was also happy that I had spent enough time with her to understand what was going on. And she was also happy that I was able to do some tests to kind of explain what was going on. And I explained to her that the emotional trauma had really kind of depleted her neurologic system of the things that are needed for her sympathetic and parasympathetic nervous system to work, for her sympathetic nervous system to give her the get up and go to be able to pursue school and other activities, and her parasympathetic nervous system was depleted, and it was causing her to be unable to rest. So I told her that we were going to give her the building blocks for her nervous system to work more efficiently, and that it should improve her daughter's symptoms. And after 6 weeks of Amino Restore and Easy Calm, if you look at this HRV, this is like a fetal heart tracing, looking at the variability of the fetal heart rate. Well, this is looking at the variability of the adult heart rate, and it should be very variable. It should be very irregular. So you can see this is much more irregular than this one. This is more of a flat line. And so when you increase the neurotransmitters, the heart rate variability improves and becomes more variable, as you can see here. So even if you don't understand HRV, and if you don't, I will provide a link to help to explain it. But you can see this looks much different. That means that her sympathetic and her parasympathetic nervous system are working much better. And you can see in this little fitness profile, this area here, this is where the patient was before. And you see she's moved more toward this healthy range, and this box is actually normal. So this is improved to the point of being normal in just 6 weeks. And if you look at this power grid, this is looking at her total power, the total power of her sympathetic and parasympathetic nervous system. And here you can see the total power is 210. I know it's small, but it's 210. And this is the area of parasympathetic activity right here, and you see she almost has none. And after 6 weeks of Amino Restore, the total power has tripled to 600. It still should be about 2,000 in a patient that young. And you see she has some parasympathetic activity. And then also you see here that this is the sympathetic area, that when she stands up, her sympathetic nervous system gets into gear, waiting and anticipating something needed to be done. That's what she didn't have before. So now her sympathetic nervous system is responding when she needs that extra boost of energy. So the patient came back after 6 weeks. Now her fatigue, anxiety, and mood swings are continuing to improve, and she reports them as being mild. She just returned from a trip to Chicago, where she met some new friends, which would have been very anxiety-provoking for her in the past. And again, her mother was crying in the office because she couldn't believe that the Amino Restore and the Easy Calm had made her daughter so much better in 6 weeks, where she had been to several other doctors in the past, and they really didn't have an answer for her. So this is just another example of how I use our Taylor MD formulation products in my office. These are pretty much the only products that I use in my office, and I'd like to show the fact that they improve objective data like the heart rate variability, and they also improve the patient subjectively. So again, this is just an example to help you understand how Taylor MD formulation products can not only help your patients, but also help your practice. So I'll try to, as I get have more interesting cases, we'll try and share them with you as we see fit. So thanks again, everybody, for listening. I hope this helped.